they sat down at the table, President Obama and congressional Democrats preemptively surrendered the one option that would guarantee every American health care without financial fear, government coverage. Republicans called that socialized medicine. Then Democrats said they were willing to cave in even further. They gave up the public option, a federal health care plan to compete with insurance, after Republicans called that socialized medicine. Tonight, in our fourth story in the countdown, the Democrats are appeasing Republicans again, proposing private co-ops to compete with insurance, and Republicans are calling it, what is the phrase they just coined? Oh, socialized medicine. Virtually as soon as Democrats began talking about Senator Kent Conrad's proposal to drop the public option and instead create privately owned co-ops to try to cover the uninsured and compete with for-profit insurance, despite the fact co-ops lack the size of a public option and therefore cannot negotiate lower prices, despite a 2000 GAO report which concluded co-ops will not lower costs, despite the fact healthcare co-ops already exist and have not lowered industry costs, Republicans say a co-op is the same as a public option, so they will not vote for this either. Senate Republican Whip John Kyle, it is a Trojan horse, a step towards government-run health care. Senator Orrin Hatch, a co-op is another way of saying a government plan. Senator Jim DeMint, a government takeover. So any Republican now that helps them pass a bill is helping them pass a government takeover. In other words, Democrats, even if we give up co-ops next year, it doesn't matter. Even if we give up everything, it doesn't matter. And if we elect a 70-seat majority that won't use its majority, it just doesn't matter. It just doesn't matter. It just doesn't matter.
We win, even if we play so far over our heads that our noses bleed for a week to 10 days. Even if God in heaven above comes down and points his hand at our side of the field, even if every man, woman, and child held hands together and prayed for us to win, it just wouldn't matter. It just doesn't matter if we win.
Joining me on Mr. Murray tonight, Jonathan Cohn, senior editor of New Republic and author of Sick, The Untold Story of America's Healthcare Crisis and the People Who Pay the Price. Thanks for your time tonight.
Thanks for the Bill Murray introduction.
It's a tough act to follow, but a good one at least. This GOP news release that says a public option by any other name is still government-run health care. Can you explain why that's not true of co-ops?
Well, I mean, the first thing to note is we still don't entirely know what the co-ops are. I mean, it's hard to say what they are, what they aren't. This was an idea that Kent Conrad invented at some point, and we're still waiting to find out what it is. But, you know, it's safe to assume that given that Kent Conrad doesn't like a public option and that the conservative Democrats who keep talking up the co-op idea don't like the public plan option, that this is probably not a public plan option. It is something considerably watered down from that idea.
We hit the highlights before Bill Murray's appearance there. Why in depth would co-ops do less than a public option to save taxpayers money?
Well, look, I mean, the whole reason a public plan would save taxpayer money, right, is that it would look and act a little bit like Medicare. It would have the same efficiencies as a government program, would have the same broad reach as a government program. Now, if you're designing an alternative to that, that is watering it down, if the whole point of this co-op is not to be something like Medicare, well, great. You won't get something like Medicare. You also won't get the cost savings. I mean, that's in some ways, sadly, the whole point of these co-ops.
About what Senator Kyle said today, I always like to tell this story going out to a ballpark early in April in 2003. This show had been on the air exactly a week. It had consisted of nothing but live reports from Iraq, and there were these two drunken kids who came up to me, and one started to ask for an autograph, and the other one said, "No, screw him, he's a liberal." And I thought, well, what the hell? I mean, all we've done on this show is live reports from Iraq. Why are they yelling at me for being a liberal? And as time went by, I thought, you know, there's a license in there. If I'm doing my job and I'm being utterly neutral and I'm giving what was the Bush administration at the time a benefit of the doubt that it turned out not to have deserved, and these drunken clowns were still dismissing me as a liberal, I could be a liberal. They're going to dismiss me anyway. Did John Kyle just do that? If he's the party whip, he's in charge of wrangling Republican votes, and didn't he just give the Democrats license to do what they want by saying that even a co-op is something Republicans won't vote for?
I think so. I mean, look, Every single time the Democrats make some sort of concession, like you said, they started at single payer, then they went down to a public option. Now they're down to a co-op. It's not like the Republicans are friendlier to it. I mean, look, back when the Democrats wanted to propose, all they wanted to do was expand health insurance for kids. Remember that debate 2 years ago? What was the charge against it? It was socialized medicine. I mean, I think by now it's pretty clear most of the Republican Party simply has no interest in health care reform. Period. End of sentences. And if that is the way they believe, I don't really think you can negotiate with them in good faith.
So, but they took themselves off the table. I mean, don't we not now have to assume that if the Democrats themselves pass weak reform, it is now entirely of their own doing?
Well, certainly mostly of their own doing. Unfortunately, the rules of the Senate may be such that they have to get 60 votes. That may mean having to pull in a Republican or two. Hopefully there are those 2 Republicans in Maine who actually are pretty reasonable on these issues. But yes, I mean, you know, in general, this is now on the Democrats. And the Democrats need to decide, look, they won an election. They won a big majority. Are they going to step up the plate? Are they going to deliver health care reform or not?
Jonathan Cohn with The New Republic, author of Sick. Many thanks for your time tonight.
Thanks for having me.